You have Dr. Toh Keng Kiat, Medical Director of Cryoviva, to share with us today the great topic on the hope and scope of cord blood banking in the healthcare. In the area of cord blood banking today, Dr. Toh was a director and consultant to Singapore's first private cord blood bank in the late 1990s. He joins Cryoviva as a medical director with several years of experience in cord blood banking, hematology, transfusion medicine, and management of blood disorders. He is also actively involved as a consultant to international laboratories involved in clinical trials. So without further ado, let's welcome Dr. Toh to start his presentation.
Hello, good afternoon, ladies and gentlemen. Welcome to this seminar. As you have heard, I've been dealing with cord blood stem cells for a fairly long time. And I come to you with many years of experience in blood transfusion medicine as well. Now, hardly a single day goes by if you look at the local papers without seeing some news about stem cells and what they can do for us in the area of medical treatment. Just this morning, I read the article in the BBC which indicated that two ladies with a neurological medical problem have decided to go to Russia for stem cell treatment of a condition known as multiple sclerosis. And back home, there is a good news that stem cells will now be used to treat children with autism when we accepted an invitation from the KK Maternity and Children's Hospital to participate in their program of using stem cells to manage autism.
Video.
What do you mean redo?
Video. You play the video.
Oh, you didn't play the video.
Hi, there's no sound. You might want to turn on the sound.
Fever. 2. Receive your cord blood pregnancy. During pregnancy, stem cells of the baby build all the baby's systems. During labor, the umbilical cord still holds a lot of precious cells in the cord blood, and instead of being discarded as biological waste, it can now be collected and stored. Further on, these blood-forming stem cells can help treat conditions such as cancers, immune deficiencies, and genetic disorders in your baby. Cryoviva's mission is to bring the miracle of stem cells in your baby's cord blood to its full potential. The process is quite simple. 1. Sign up with Cryoviva. 2. Receive your cord blood collection kit. 3. During labor, your doctor will collect the blood into the collection kit and Cryoviva's courier will transport it to a storage facility. 4. The blood will be tested for infections and stored securely. Cord blood is currently utilized in the treatment of around 80 diseases, including different types of lymphoma and anemia. By saving the cord blood of your baby, you are getting a potentially life-saving option available for your child and your family. Your decision today may save a life tomorrow. Secure the future of your child. Visit www.cryoviva.com for more information.
Apologies for that little glitch there. As I was saying, stem cells feature greatly in medical treatment today, and you must be congratulated for deciding to have a baby, because that's the first step towards allowing you to make the decision of having your baby's cord blood, which contains the stem cells, to be collected and stored for future use. Now, what are stem cells? These cells are cells that have got great potentials because of two properties that they possess. One is that they can regenerate, and two, they can also differentiate. By this I mean that the stem cell, which is a raw cell, can become cells of other tissues in the body, but along the way, as they do that, they also are able to preserve themselves and keep themselves alive for future use. So stem cells have been featured greatly in the repair, replacement, regeneration, and restoration of tissues in our body. Now, the history of stem cells started about a century ago when they were first recognized, but it was a long history of searching to understand what these cells are and how they can be used. And that use came only about more than 80 years later on, from 1990 to 1988, when the first transplant using the baby's cord blood stem cell was used. I'll have more on that later on. Thereafter, the development of stem cells has been in the areas of finding ways to conserve and to preserve these stem cells that were in the cord blood after the child's birth. Now, stem cells are found in many other places besides just the umbilical cord blood or cord tissue. And in the adult human being, they can be harvested from bone marrow, the skin, and other areas. But there are differences in the stem cells from these different areas, as you can see in this very important slide. On the left-hand side, under the red and yellow columns, I've highlighted the properties of cord blood stem cells and cord tissue stem cells, and on the right-hand side, under the yellow banner, the stem cells harvested from bone marrow. Now, first of all, the collection of stem cells from the cord blood is a simple process that takes only a few minutes, whereas the harvesting of bone marrow stem cells takes a long time. You have to search, first of all, for a suitable donor, and then the donor has to be placed under general anesthesia for the marrow cells to be harvested. Then the other big difference is that once you have harvested and stored the cord blood stem cells, they are ready for use and available at any time. Whereas bone marrow stem cells are never harvested in advance, they are only done after a need arises and a suitable donor is found. Then there is a third heading, which is the matching, which is extremely important. If you pay attention to the figures there, on the left-hand side under cord blood, you can get figures like 4, 5 over 6, but on the right is 6 upon 6. What this means is that of the genetic markers that are present in all our cells, they have to be perfectly matched if you want to transplant bone marrow stem cells. But using cord blood or cord tissue stem cells, a greater degree of non-matchable, 100% matchable donor and stem cells, situation can be tolerated. And then the fourth thing is the age. When we harvest stem cells from the cord blood and the cord tissue, they are taken at the time of the birth of a child, which means that they are as young as the donor is, which theoretically is 0 age at that time. But when it comes to the stem cells from the bone marrow, it depends on how old your donors are, and that will be the age of the stem cells. And in fact, age is also a limitation to any adult person being a stem cell donor. And then the rest is also the concentration of the number of early cells in the marrow tissue or the cord blood and cord tissue stem. Now, where does all this begin? Well, it starts off in the baby when it is conceived, and it starts in the umbilical cord. The umbilical cord, which joins the baby to the placenta in the mother, is a structure that's tube-like, that consists of a few blood vessels surrounded by a pinkish substance known as the Wharton's jelly that is enclosed in a membrane. Within the blood that is flowing in the vessels is a set of stem cells known as HSCs, or hematopoietic stem cells, and within the Wharton's jelly, MSCs, or mesenchymal stem cells. Do not be worried if you can't remember the long names, just keep in mind the HSCs and the MSCs. Now, the stem cells, as I mentioned earlier, have got two properties. They self-regenerate, and then they also have great potential to differentiate. The HSCs differentiate into the adult definitive cells of our blood, which are the white cells, the red blood cells, and the platelets. Each of these sets of cells has a specific function. The white cells to protect us against infection, red cells to carry oxygen, and the platelets to arrest hemorrhaging when it occurs, and also to provide an impetus to tissue repair. MSCs, the others are called tissue stem cells, are the originators of the superstructure of the human body. And by this I mean the cartilage, the bones, the muscles, the adipose tissue or the padding tissue, and then the neurological system tissues that help to drive this, body, and also the muscles that move our joints and participates in, motion. But at the same time, MSCs are also active in the formation of specific organs like the heart and the liver. Now, collecting the cord blood and cord tissue stem cells is a very simple process. At the time of the child's birth, the stem cells are collected, then they undergo a process of identifying the cells and then making sure that they are healthy and free of infection before they are then stored under special conditions, ready to be used and retrieved when the need arises. Now, at the time of birth, as I've said, the cord blood and cord tissue is collected, and that happens when the umbilical cord is severed, and within a short time, the blood from the cord that is still attached to the placenta is drained into a collecting bag. A segment of the umbilicus is also cut and then all preserved in containers, which you see here, the red container, the bag that carries the blood, and another bag that carries the umbilical cord. At the bottom on the left hand side, there are 3 test tubes in the circle with a blue background. Blood is taken from the mother to ensure that at the time of birth, there is no infectious disease or problem that may be transmitted during the birth procedure to the baby, and hence render the specimen not fit for storage or use. And very quickly it is brought by the ambulance to our processing facility, which is in Marymount. And at the processing facility, the specimen is separated, but the actual harvesting process begins when you sign up to enroll to have this done. And that is the time when the mothers will be given a delivery kit with you to keep at home and bring to the birthing facility. And then when you are there, to give it to the doctors and nurses there who have been trained to do the harvesting process, and then to properly store it before we bring it for processing. And at the bottom, the last 2 circles on the left, the processing procedure includes, as I have said, exclusion of infectious diseases, but also procedures to ensure that there are enough of these stem cells and that they are healthy and viable, so that we don't waste the time and money to have them harvested and then find that they are not suitable for use. And the cells that are collected are then put into liquid nitrogen tanks and undergo very slow, extreme cryopreservation, bringing the temperature down to minus 200 degrees Celsius. Now, earlier on, when I was talking about the history of stem cells, I said that it took almost 90 years since the discovery before it was used in 1988. The gentleman in pink suffers from a hereditary form of anemia. He couldn't get treatment in the United States. The parents brought him to Paris to be treated by this French doctor, and she used the cord blood from a sibling who was conceived for that purpose, and he had a successful transplant, and he himself now has grown and become a parent. I mentioned also that many diseases have been treatable and are treated with stem cells, and earlier on in the video, the figure 80 was mentioned, and this is still a growing list of conditions that can be treated. And a lot of these are in classes like the anemias on the top, the leukemias, the adult, blood cancers like multiple myelomas, and then also immune deficiency problems. A pie chart here shows the use of mesenchymal stem cells in various conditions under study around the world. And as I've mentioned earlier on, we are glad to announce that Cryoviva is now a participating member of research in treating autism with cord blood stem cells and also mesenchymal stem cells. Around the world, there has been a lot of interest in managing problems like this. From far away, report from a mother who was relieved that her son was having some treatment for his autism. And then I want to play you a video of can you have it on, the audio?
Stroke is the leading cause of permanent disability in the U.S., striking nearly 800,000 people each year. Hemorrhagic stroke can be particularly devastating, as 40% of patients die within a month and half of the survivors have permanent impairment.
A hemorrhagic stroke is when there's bleeding or a burst blood vessel in the brain.
But neurologist Dr. William Freeman says it may be possible to heal the injured brains of stroke survivors using their own stem cells. He has the FDA's approval to treat a dozen patients in a pilot study.
Mesenchymal stem cells, as we call them MSC for short, are powerful anti-inflammatory agents.
Stem cells also have the ability to differentiate into virtually any type of tissue.
We call them regenerative because they help tissues heal faster in ways that we're starting to study, and it's very exciting.
Okay, you have heard that commentary on the stem cells being used to treat strokes. As you all know, there are two types of strokes, One is hemorrhagic, which was talked about here. The other is a thrombotic stroke where a clot forms in the brain. You can't do much with that kind of stroke with stem cells, but hemorrhagic stroke, you can heal the damaged cells by using stem cells from the patients themselves. Now, stem cells have also been used in various other situations, like managing complication from transplant, which is very fearful, and to doctors involved in this area, and that is to control graft versus host disease. Now, what this means is that the engrafted tissue turns around and attacks the host into which it is given, which is why the emphasis on using bone marrow stem cells was that you must have a full match of 6 out of 6, but if you use cord blood or cord tissue, you can tolerate a greater degree of discrepancy. In fact, if you use MSCs, you don't have to think of tissue typing at all. And then, of course, there are other conditions like pancreatic disease where stem cells may be used. Now, sad stories about how the lack of stem cells can impact a person's life was reported in our Straits Times a couple of years ago. This young gentleman had leukemia. He responded very well to treatment, but had to have a stem cell transplant to round off the whole process, and he did not have any available from family members or himself. And the parents, although they found a suitable donor from donor registers, were disappointed when the prospective donor could not be located to respond when the time came. By the way, there are things known as donor registers where one may be able to apply to and get some stem cells. But these are not ideal situations, as you can see what happened here. In Singapore, there was a report of a child whose parents had the foresight to have his cord blood harvested and kept. And then when he was growing, he was found to have a condition known as cerebral palsy, a neurological problem that arises from damage to the brain and affects the locomotion and muscle activities. And he was treated with his own stem cells. Another story from Singapore, this pair of parents had a child with the subacute immunodeficiency syndrome, where the child's system just cannot produce the cells to fight against infection. And because of that, he had lots of problems, including a painful skin condition known as eczema. The parents found stem cells and he was successfully treated. So now, any facility that is involved in providing this kind of services has to be very well, registered and also verified to be able to deliver this sort of treatment. It is just like you going to a bank to store your money. You must make sure that that bank is a good bank which will not go bust or gives inferior service. And in this area of blood banking, we are accredited by a few bodies. First of all, the Ministry of Health, which gives us the license to operate and to which we have to comply with a lot of conditions. Then internationally, we subscribe to AABB accreditation, or American Association of Blood Banks, which is the gold standard by which all blood banks are measured for proficiency. Then ISO 9001 year 2015, which makes sure that the processes involved in our practice and running of the bank is up to international standards. So I'm coming almost to the end. You're going to have a full and a very busy year with your baby, trying to manage his growth during this time, and also making important decisions like having his cord blood tissue and cord blood itself to be harvested and banked. But at the same time, also bearing in mind that today's good parenting practice involves things like taking care of your child to have him protected against various things, and then also, making sure that, you have available, services which are based on a 24-hour kind of availability. So in Cryoviva, we have partnered some insurance, providers, and there are different insurance packages, including one which is highlighted in the red, blow up, which gives you protection, and for initial disease treatment up to $136,000, which is equivalent to the adult's insurance of catastrophic illness. I treat many patients with things like cancers or long-term illnesses, and that kind of insurance gives you only $75,000. Okay, thanks for listening. And then for that, you will be rewarded with some, special packages which my marketing team has asked me to put up. So do avail yourself of this. And then now, question time.
Okay. How many times can the collected cord blood be used for treatments?
Okay, generally the cord blood that we collect from a baby is not very much, up to 100 cc's. And then, you're taking blood from a small child of, say, 2 kgs. And then when the child grows up and needs it for himself, he will be very much bigger than that. So theoretically, it is only once. But there are available now procedures known as cell expansion. Let's say if the child's cord blood were to be used by a sibling or a parent for any other medical treatment, we can take an aliquot or portion of that stem cells and let it undergo a process of expansion where cells are made to multiply manifold, and we can use that for more than just once. And as I say, it also depends on the type of disease that you are treating. Some conditions require more stem cells, others just as a part of your other, or an adjunct to other treatment. Next one. Okay. Okay, I think I've exhausted my time. I've got to hand over to the next speaker, and then those who have asked questions, we will reply uh, in our sort of email or by this chat.